I've had lengthy discussions about vaginosis before I finished my first coffee, woken up to texts with photos of rashes, abscesses, or ingrown hair follicles with strings of crying emojis, and been asked several times if X, Y, or Z warrants a trip to the ER. Even as a nurse, I am not immune to this conundrum of what does and doesn't constitute an emergency. One summer, furiously deadheading an ancient English rosebush, I whacked my hand on the trunk, and a thorn the size of a child's thumb went through and bashed one of the slender bones in the back of my hand. Thinking it might be fractured, and since I was in the midst of taking clinical microbiology, sure I had contracted Sporothrix shankii, rose gardener's disease, I indeed went to the ER because it was a Saturday afternoon, and I still want to kick myself for it. At this fork in the road, with signs pointing to the emergency department, an urgent care center, or a U-turn back home to bed, most patients are at a loss, without resources to help them make a decision. Their best bet? The internet. Phone a friend. Err on the side of caution. These moments when you're feeling like a shell of a human being can cost either a lot of money to address or a lot of suffering to wait out. And waiting it out can be dangerous. Without the appropriate antibiotic, an infection can linger indefinitely, especially in harsh winter conditions and when people are under stress. Wounds dealt with at home that actually required medical attention can become infected, putting people at risk for systemic problems. Fractures that go undiagnosed can heal improperly. Serious dehydration or an immune reaction sometimes just needs medical intervention. On the other hand, it's likely that at one point or another you've regretted making the decision to go to the ER. You might have spent hours camped out in various waiting rooms, finally advanced to a private exam room, and then waited endlessly for Dr. Schmoop to come in and tell you to take a high dose of ibuprofen, wasting you a good deal of time. Oh, and money! Emergency rooms are monopolies, and they take advantage of their market share. Take a hospital bill for services rendered and multiply it substantially, and you'll have an idea of what an average trip to the ER costs. For stitches, $1,200. For an MD to pat you on the head and send you on your merry way, or in more generous terms, for peace of mind, $500 to $1,700. There are times when an ER is absolutely necessary. We will identify many of them soon. There are also countless circumstances in which an urgent care facility is a better bet, less expensive with shorter wait times. The draw of the ER. One of the first emergency departments in the United States was a 2-bed facility at Johns Hopkins called the Accident Room. Patients were brought in via the town police wagon and treated free of charge. It all sounds idyllic compared to the chaotic holding pens we're familiar with today. The function of emergency rooms today is a hot-button topic in the medical community, where industry leaders have made serious efforts to stem unnecessary visits. Insurance companies have gone so far as to refuse reimbursement when they deem an ER visit unnecessary. Save the ER for emergencies, or cover the cost, reads a letter sent in 2017 to Blue Cross and Blue Shield customers of Georgia. Going to the emergency room, ER, or calling 911 is always the way to go when it's an emergency, and we've got you covered for those situations. It continues. But starting July 1st, 2017, you'll be responsible for ER costs when it's not an emergency. The trend isn't a new one. For years, U.S. insurance companies have gotten away with denying claims based on the ultimate diagnosis when a patient goes to the ER. It means that if you have chest pain, think you're having a heart attack, go to an ER, and find out it's something non-urgent like a respiratory infection, you'll be settled with the bill. First and foremost, this is unlawful, as the prudent layperson standard, codified in federal law with the advent of the Affordable Care Act, states that reimbursement must be based on symptoms a patient is experiencing when they go to the ER, not the diagnoses. According to the American College of Emergency Physicians, insurance companies are taking advantage of political turmoil around the Affordable Care Act to push the envelope with these practices once again. It angers healthcare providers. This message sent on full blast to American patients that they're not to cry wolf or there will be consequences. It means someone might endure a stroke or a pulmonary embolism without going to an ER out of financial fears. To assume that the average patient can distinguish emergency from non-emergency situations confidently is unconscionable.